Hi and welcome to Physical Therapy TV. In today's episode, I'm going to share with you a recent study that shows how you can avoid low back pain and bulging disc surgery. In 2007, there was a study done at Newcastle University in the United Kingdom that showed that the use of inversion tables in conjunction with physical therapy were helping people avoid low back surgery, especially for bulging discs, cutting their percentages down by at least 70%. So there were two study groups, one group that received just physical therapy for low back pain and bulging discs, and the second group were having physical therapy and the use of inversion table treatments in conjunction with the therapy, and the study showed that 70% people were less likely to need surgery for bulging discs. I found this truly amazing. You might be wondering, what is an inversion table? You've probably seen this advertised on TV or maybe in some sport equipment stores, but it's basically a device which supports your whole body. Your feet get hooked onto the bottom portion with a supportive device, and you are able to adjust any angle for treatment. What's neat about this is that it is fully adjustable, so you can be fairly horizontal or you can really angle yourself. The ultimate angle that the study showed was 60 degrees to get the most effective results. So these are very unique tools, and I found it very interesting and thought I would share this with you. Now, what are the effects of inversion therapy? Well, we use in practice many times a device called a traction machine, which you can use either on your neck or your low back. In this case, what the inversion table does, it does the same as what we use in the clinic as far as traction, and what it does, it increases the disc space, reducing pressure on your bulging discs and thus reducing the pain that you might be receiving in your low back or even radiating down your leg. It provides traction to your hips. Believe it or not, a lot of our low back problems and the associated pathologies such as degenerative disc disease, sciatica, bulging discs stem from weak and inflexible hips. So what the inversion table does, it provides tractions on the hip joint and the low back joints, which will relieve the joints and also align those joints to some extent. Lastly, it can reduce muscle spasm, and you can get a good stretch on this device, not only for your low back, your hips, but also to your upper torso, and allow you to do some movements to re-engage some muscles that have become very, very tight. So I think this device has some value. Now, if you suffer with degenerative disc disease, sciatica, bulging discs, low back pain, certainly this device in conjunction with physical therapy might be the way to go and might be worth a try. Now, there are some precautions with this. It can raise your blood pressure. So if you have blood pressure issues, it won't be advisable. If you have glaucoma or a detached retina, it can definitely cause further damage, and obviously if you're pregnant, you don't want to be getting yourself in compromising positions. Bottom line, check with your physician before considering something like this. Now, where should you buy this? Well, you can do a search online. You can find some local stores that sell this device, and I would probably go for a test drive. I would go over and test the machine, make sure you're comfortable in it and you don't experience extreme pain. You might also call some of the local physical therapy practices in your area and find out if they have a device such as this, which will allow you to maybe stop by and just test it out. So what I did was, in addition to this video, is I created a free PDF report for you that I think would be valuable for you to use in conjunction with if you were to consider using an inversion table, and it would cover what to do as far as exercises and stretching when you use this device. I'm also list for you a list of websites that sell inversion tables so that you can do your homework. That's it for today. Thanks so much for watching, and if you have any questions or comments, you can leave it on the page below. Thank you so much.